Here are 20 conditions or treatments aspirin used for. Pain relief. Aspirin blocks the production of prostaglandins, which are chemicals in the body that contribute to pain sensation. By inhibiting prostaglandin synthesis, aspirin reduces pain perception. Fever reduction. Similar to its action on pain, aspirin inhibits prostaglandin production in the brain's hypothalamus, which regulates body temperature. This reduces fever by lowering the set point of the hypothalamus. Inflammation reduction. Arthritis, joint pain. Aspirin's anti-inflammatory properties come from its ability to inhibit the enzyme cyclooxygenase, COX, which is involved in the production of prostaglandins that cause inflammation. Prevention of heart attacks and strokes. Aspirin inhibits platelet aggregation, preventing the formation of blood clots. This reduces the risk of blockages in the arteries supplying the heart and brain, thus lowering the risk of heart attacks and strokes. Prevention of blood clot formation. By inhibiting platelet aggregation, aspirin interferes with the blood clotting process, reducing the risk of blood clots that can lead to conditions like deep vein thrombosis, DVT, or pulmonary embolism, PE. Treatment of mild to moderate migraine headaches. Aspirin helps alleviate migraine pain by reducing inflammation around blood vessels in the brain and inhibiting the release of certain neurotransmitters involved in pain signaling. Relief of dental pain. Aspirin can provide relief from dental pain by reducing inflammation and inhibiting pain signals in the nerves of the affected tooth or gum tissue. Prevention of preeclampsia. In pregnant women, aspirin may help prevent preeclampsia by improving blood flow to the placenta and reducing inflammation, although the exact mechanisms are not fully understood. Reduction of risk of colorectal cancer. Aspirin's anti-inflammatory properties may help reduce the risk of colorectal cancer by inhibiting the production of prostaglandins and other inflammatory molecules that can contribute to tumor formation. Management of rheumatic fever. Aspirin is used to reduce inflammation and relieve symptoms associated with rheumatic fever, an inflammatory condition that can affect the heart, joints, skin, and other organs. Prevention of thromboembolic events. In patients with atrial fibrillation, aspirin may be used to reduce the risk of thromboembolic events, such as stroke, in patients with atrial fibrillation, a heart rhythm disorder, by preventing blood clot formation in the atria of the heart. Relief of acute gout attacks. Aspirin's anti-inflammatory properties can help reduce inflammation and pain associated with acute gout attacks, which occur due to the buildup of uric acid crystals in the joints. Treatment of systemic lupus erythematosus, SLE. Aspirin may be used as part of the treatment regimen for systemic lupus erythematosus, SLE, to help manage symptoms such as joint pain, inflammation, and fever. Management of chronic kidney disease. In some cases of chronic kidney disease, CKD, aspirin may be used to help manage complications, such as cardiovascular disease, by reducing the risk of blood clots and inflammation. However, its use in CKD must be carefully monitored due to potential risks to kidney function. Reduction of risk of preeclampsia. In pregnant women at high risk, high-risk pregnant women may be prescribed aspirin to reduce the risk of developing preeclampsia, a pregnancy complication characterized by high blood pressure and potential organ damage, by improving blood flow to the placenta and reducing inflammation. Treatment of acute ischemic stroke. Aspirin is often administered immediately following an acute ischemic stroke to help prevent further blood clot formation and reduce the risk of recurrent strokes. Prevention of recurrent transient ischemic attacks. TIAs. Aspirin therapy may be recommended to individuals who have experienced transient ischemic attacks, TIAs, or mini-strokes, to reduce the risk of subsequent TIAs or full-blown strokes by inhibiting platelet aggregation and blood clot formation. Management of unstable angina. Aspirin is commonly prescribed for individuals with unstable angina, a type of chest pain caused by reduced blood flow to the heart, to help prevent blood clot formation and reduce the risk of heart attack or myocardial infarction. Treatment of pericarditis. Aspirin may be used to reduce inflammation and relieve chest pain associated with pericarditis, an inflammation of the pericardium, the sac surrounding the heart. Reduction of risk of Alzheimer's disease. Some research suggests that long-term aspirin use may be associated with a reduced risk of developing Alzheimer's disease, although further studies are needed to confirm this potential benefit and elucidate the underlying mechanisms.
What is aspirin? What used for? Aspirin, a widely recognized medication, is a nonsteroidal anti-inflammatory drug NSAID primarily used to alleviate pain, reduce inflammation, and lower fever. It works by inhibiting the production of certain chemicals in the body that cause pain and inflammation. Additionally, aspirin is often prescribed to prevent heart attacks and strokes, as it can help reduce the risk of blood clots by making platelets less sticky. Its versatility and effectiveness have made it a staple in medicine cabinets worldwide. Watch next. 25 condition or treatment aspirin is used for video. The content provided in this video is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional before making any healthcare decisions.